So let's say you've developed chronic kidney disease. Your kidney function, you've treated your vasculitis, you're in remission, woohoo, congratulations. But you're left with not perfectly normal kidney function. So there's some things to be aware of with that. So as I was telling folks yesterday, yeah, vasculitis, kidneys, et cetera, but once you have chronic kidney disease, there are complications that arise simply by virtue of having chronic kidney disease. They don't have anything to do with vasculitis. It's just by not having normal kidney function. So those need to be monitored and managed. And you also have to be mindful of other things that can negatively affect your kidney function. So blood pressure. If you have high blood pressure, please don't go to the nephrologist and say, but my blood pressure's always been 160/100. That doesn't make it normal. If you had a big tumor growing out of your forehead and it's always been there, it doesn't make it normal. So you gotta treat that. If you're overweight, now I don't want you to go crazy. No fad diets, no crash diets. But if you're really overweight, that's a risk factor for kidney disease. So you gotta work on that and be diligent about that. And obviously your blood glucose or your blood sugar, if you have diabetes or if you have borderline diabetes, make sure that you manage that you do whatever you need to do to keep it under control. So in reality, the blood pressure and the blood sugar, having diabetes, those are the two biggest risk factors for having end-stage renal disease requiring dialysis or transplant. So if you've already got vasculitis, and then you compound that with the two worst things that you could have, then you're not doing yourself any favors. So definitely manage those. And then these other things that are listed are those complications that arise or can arise, not in every single person, as a virtue of having chronic kidney disease. And they tend to occur as kidney function is lower. So if you have sort of relatively mild or moderate renal insufficiency, you may not see these, but they have to be monitored. So your red blood cell count may get low, so you may be anemic, and that can be for a couple of reasons, or more than a couple. Your calcium, your phosphorus, PTH was parathyroid hormone that helps regulate your calcium and phosphorus, your vitamin D levels, your uric acid levels. These can all become abnormal. It's a great thing to manage those and take care of them. Your electrolytes. Is your potassium too high because you have chronic kidney disease? Or are you on a diuretic that makes it too low? Important, you need to fix that. Are the acid levels in your blood too high? Important to address that. And cholesterol. So what does cholesterol have to do with kidneys? Well, in a sense, nothing directly. But having chronic kidney disease is a risk factor for cardiovascular disease. People with kidney disease, irrespective of what caused their kidney disease, they tend to die of cardiovascular disease, not of their kidney disease. So we try to deal with anything else that can contribute to cardiovascular disease. Cholesterol is a big one. So if you have high cholesterol, if you can change it with diet, great. If you can change it with exercise, great. And if you can't, be willing to be a little open-minded about medications for managing that. You're just trying to eliminate a risk factor for having another problem.